Hi, my name is John Tenorio, and this is a video for Medical English. I'm going to talk about the pathogenesis and diagnosis of growth hormone deficiency in adults. So, definition: growth hormone deficiency or disorder of the endocrine systems occurs when the body does not produce enough growth hormone, aka somatropin, due to issues in the gland of the anterior pituitary. In children, growth hormone is essential for their normal growth, muscle and bone strength, and the distribution of the fat in the body. It also helps control level of glucose and lipids in the body. Applications in medicine. This pathology can be caused by congenital, acquired, or idiopathic factor. The person who develops growth hormone deficiency may report central weight gain, difficulty to lose weight, dry skin, and fatigue because of the other effects of the pituitary. The diagnosis it is through a hand X-ray, blood test, MRI, or the direct stimulation test of the pituitary gland to secrete the hormone.
Hello. In this health sketch, we want to talk to you about growth hormone deficiency in children, a condition that occurs when the body can't produce enough growth hormone. We'll talk about what it is, why it occurs, its signs, and how it's managed. Growth hormone deficiency is treatable, and with careful management, most people are able to enjoy long and normal lives. Hormones are chemicals that travel around the bloodstream, giving messages to different parts of the body. Growth hormone is released by the pituitary gland in the brain and stimulates the growth of bones, muscles, and organs in our body. Growth hormone deficiency is caused by a problem with the pituitary gland, such as a small or missing gland, which leads to less of the hormone being produced. Growth hormone deficiency in children is rare, occurring between 1 in 3,000 and 1 in 10,000 children. It tends to be more common in boys than girls. The extent of growth hormone deficiency can vary from mild to severe. Either way, growth hormone is widely available in the UK, so everyone should be able to get the treatment they need. Children with growth hormone deficiency are short and might look young for their age, as a lack of growth hormone delays physical development and bone growth, but their bodies are in normal proportion and they have normal facial features and normal intelligence. Before starting treatment, children with growth hormone deficiency might be overweight, as growth hormone also helps to control the amount of fat under the skin. It's diagnosed using blood tests to measure the level of the hormone in the blood. This is called a growth hormone stimulation test. Once diagnosed and on treatment, height is regularly measured to monitor growth, and sometimes a bone scan and brain scan might be done. It's treated with a small injection of growth hormone each day. Injection sites tend to be in the stomach, thighs, and buttocks. The dose will change as the child grows. Treatment is usually led by a doctor specializing in children's hormones, called a pediatric endocrinologist. There are usually no side effects, although sometimes there might be a small skin reaction at the injection site, which can be treated by moving the injection site. Very rarely, children might suffer headaches, vomiting, or problems with eyesight, which can be stopped by reducing the dose. It is important for any side effects to be reported to your doctor. It is natural to sometimes feel worried or upset about having growth hormone deficiency or having a child with growth hormone deficiency, and you should talk about these feelings with your doctor. Patient support groups are a good source of support, as you can connect with others with the condition who have had similar experiences. For most children, growth hormone treatment enables them to return to normal growth and reach their expected height. We hope this health sketch has been helpful to you and those around you. Health sketch. Health for all to see.
Pros and cons. Pros. If it is diagnosed at an early age and treatment is carried out, positive results are obtained. Cons. The treatment produces some side effects such as gynecomastia, scoliosis, pain in the muscle, and headache. The affected child may present psychological problems, low self-esteem, and sadness due to their condition.
Growth hormone deficiency AGHD. In adult growth hormone deficiency, there is reduced lean body mass, increased waist to hip ratio, and increased fat that leads to hyperlipidemia and hypertension. The system most affected by Adult GH deficiency is the cardiovascular system. There is left ventricular dysfunction and a threefold increase in cardiovascular mortality. On the bone, there is reduced bone mineral content and increased fracture. There is hyperfibrinogenemia. 25% of the patient have low normal IGF-1. The psychiatric features in adult GH deficiency are anxiety, depression, loss of memory, and lack of concentration. So, how the adult GH deficiency is diagnosed? The test to diagnose adult GH deficiency is insulin induced hypoglycemia. When blood glucose goes down to 60 milligram per 100 ml 1 hour after the peak GH level occurs and remains so for 2 hours. In 90% of normal individuals, the GH is more than 5 microgram per liter. A GH level of less than 3 microgram per liter indicates GH deficiency or AGHD. So, what are the contraindications to insulin-induced hypoglycemic stress test? Contraindications are diabetes, ischemic heart disease, cerebrovascular disease, epilepsy, and elderly patients. The other tests done are L-arginine test, GHRH test, and GHRP test. Growth hormone, release hormone, and growth hormone receptor proteins.
Hmm. Issue applied in Ecuador. To offer a correct and timely diagnosis to children with growth hormone deficiency, the Los Ceibos General Hospital has created the Clinic of Low Size of the ES, made up of pediatricians, neonatologists, and endocrinologists. Conclusion: it is essential to carry out the correct diagnostic studies on the child in time to be able to start with an early treatment and obtain the better therapeutic results. Thanks.